What is the mission of the ASH? Empowers individuals, families, and communities to achieve sexually healthy lives through education and advocacy. The history of ASHA. It was an award-winning and trusted nonprofit organization that has advocated on those people who are at risk for sexually transmitted infections since 1914. In 1914, the ASHA was founded by the American Social Hygiene Association. It was a public health group committed to attacking a social condition called venereal disease, VD. The audience of ASHA is anywhere from the public, patients, press, providers, and policymakers to develop sensitive topics related to health information. The main focus of audience is public and college health clinics across the United States. These clinics order pamphlets and books from the ASHA to give to their clients and students. What is our focus? Educate for people in the world to turn to ASHA for guidance and quality non-biased information on sexual and reproductive health. Build alliances. ASHA works with a lot of national organizations that share the same goals of promoting sexual health issues. Advocate. We work in coalition with organizations in family planning, HIV, and women's health, as well as organizations representing people of color and faith-based groups to keep STIs on the forefront of the policy agenda. Resources are provided for healthcare workers, patient education materials, teachers, parents with many materials, videos and podcasts. As there are different resources for healthcare providers, there are also many ways to help sex education teachers. For teachers, ASHA believes young people deserve balanced, accurate, and realistic sex education, as well as access to confidential sexual health services. Young people today are growing up in a culture that surrounds them with sexual imagery and messages, but one in which marriage is often delayed until late 20s. Historically, public health prevention messages have singled out abstinence until marriage as the most effective way to remain free of sexually transmitted infections, STIs, but this message does not serve well in the absence of comprehensive sexual education and a supportive environment. Research clearly shows that comprehensive sex education programs do not encourage teens to start having sexual intercourse, do not increase the frequency with which teens have intercourse, and do not increase the number of a teen's sexual partners. Research also shows that sex education programs that promote abstinence only have. You could use these resources to help you further the education for these students by giving them access to this website that has more information. There is a website called Amaze, which involves ways to learn about puberty, healthy relationships, STDs, personal safety, pregnancy, reproduction, gender identity, and sexual orientation. The American Sexual Health Association has plenty of ways to get information on sexual health. The most interesting things I found were ways to take care of your body when things start changing that you may be unaware of, and there are ways to access a provider that could help along the person's journey. As you can see, there are many ways to access the American Sexual Health Association through social media. Let's take a look at what they are sharing on Instagram right now. Instagram has plenty of different pieces of information and also resources available.